Right now, something might be slowly destroying your body from the inside. It doesn't hurt, you can't see it, but it's responsible for 60% of all deaths worldwide. It's linked to heart disease, cancer, diabetes, and even Alzheimer's disease. The scary part? Most people have it and have no idea they have it. I'm talking about chronic inflammation, and by the end of this video, you'll know exactly how to tell if you have it, what's causing it, and most importantly, how to stop it before it's too late. I'm Dr. Zaid Fadul, and before we dive in, if this kind of health information is valuable to you, I'd really appreciate it if you'd hit that like button and subscribe to the channel. We drop new videos on hormones, longevity, and preventive medicine every single week. You don't want to miss them. Now let me ask you something. Do you feel tired all the time, even after a full night's sleep? Do your joints ache? Do you struggle with brain fog or forget some things more often than you used to? Maybe you have digestive problems that won't go away, or you're gaining weight no matter what you try? If you answered yes to any of these, you might be dealing with chronic inflammation. And here's what makes this so dangerous. Inflammation is supposed to protect you. When you cut your finger or catch a cold, inflammation is your body's emergency response team rushing in to heal you. That's acute inflammation, and it's a good thing. But chronic inflammation is different. It's like your body's alarm system got stuck in the on position. Instead of healing you, it starts attacking your healthy cells day after day, month after month, year after year. And over time, this constant attack damages your organs and makes you sick. But here's what most people get wrong about inflammation, and what most doctors never tell you. The damage is reversible. Once you understand what's happening, you can take control and start healing your body. So let's dive in. Here's a question for you. How many of the 5 warning signs of chronic inflammation do you have right now? And be honest with yourself, because most people miss at least 2 of them. Let me walk you through the most common symptoms. First, there's persistent fatigue. We're not talking about being tired after a long day. This is the kind of exhaustion where you wake up tired, you're tired all day, and you can't remember the last time you felt truly energized. Second, unexplained body pain. Your joints might ache, your muscles might feel sore even when you haven't worked out. This pain moves around and doesn't seem to have a clear cause. Third, digestive problems that won't quit. Maybe you're dealing with constipation, diarrhea, acid reflux, or just general stomach discomfort that's become your new normal. Fourth, brain fog and memory problems. You walk into a room and forget why you're there. You struggle to concentrate. Your thinking feels slower than it used to. Fifth, mood issues. Depression, anxiety, and irritability can all be signs that inflammation is affecting your brain. Other warning signs include frequent infections, skin problems like rashes or eczema, unexplained weight gain or weight loss, and trouble sleeping. If you have 3 or more of these signs, you need to pay close attention to the blood test part coming up in just 30 seconds, because most doctors miss this. Now here's a critical part. Symptoms alone aren't enough to diagnose chronic inflammation. That's where blood tests come in, and this is where your doctor needs to be watching closely. The most important test we use is called high sensitivity CRP, or hsCRP. This test is particularly good at predicting heart disease risk. Your liver makes this protein whenever there's inflammation in your body. We also use an ESR or SED test, which stands for erythrocyte sedimentation rate. This measures how fast red blood cells settle in a test tube. The faster they settle, the more inflammation you have. Other markers we track include fibrinogen, CBCs, and other labs specific to any underlying disease you might have. But here's the thing, your body can feel perfect on the outside while your blood tells a completely different story. That's why blood tests are the secret to knowing what's really going on inside your body. If you have any of the symptoms I described earlier, it's important to get these tests as part of your workup. Knowledge is power, and you can't fix a problem you don't know you have. Let me show you the 9 main culprits. First, unresolved infections or injuries. When acute inflammation doesn't finish its job properly, it can linger and become chronic. Your immune system keeps fighting even though there's nothing left to fight. Second, autoimmune disorders. In conditions like rheumatoid arthritis, lupus, or multiple sclerosis, your immune system gets confused and starts attacking your own healthy tissues. It's like your body's defense system has turned against you. Third, long-term exposure to toxins and irritants. Industrial chemicals, air pollution, cigarette smoke, and environmental toxins constantly trigger your immune system. Over time, this creates chronic inflammation. That's why the best longevity programs like mine track these exposures and help mitigate your risks. Fourth, and this is huge, lifestyle factors. The way you eat, move, sleep, and handle stress has a massive impact on inflammation. A diet high in processed foods, refined sugars, and unhealthy fats feeds inflammation. Lack of exercise allows inflammation to build up. Chronic stress keeps your cortisol levels elevated, which promotes inflammation. Poor sleep disrupts your immune system's ability to regulate inflammation properly. And sitting all day, it makes everything worse. You can check out my video on the health impacts of too much sitting here. By the way, the most surprising cause is number 5, coming up right now. Most people are shocked when they learn what it really does to your body. And that's fifth, obesity. Here's where it gets interesting. Fat tissue isn't just passive storage. It's actually an active organ that produces inflammatory chemicals called adipokines. So when you carry extra weight, especially belly fat, you're essentially carrying around an inflammation factory running 24/7. Even when you're sleeping, it's producing harmful chemicals. This is why weight loss is so powerful for reducing inflammation. You're literally shutting down the factory. This creates a vicious cycle though. Obesity causes inflammation. Inflammation causes insulin resistance. Insulin resistance makes it harder to lose weight, which causes more inflammation. You can learn more about the real cost of obesity here. 6, gut problems. Your digestive system controls trillions of bacteria, and when the balance between good and bad bacteria gets disrupted, it can trigger widespread inflammation throughout your entire body. To learn more about your microbiome, check out my video here. 7th, aging. As you get older, your immune system naturally starts producing more inflammatory markers. Father Time is undefeated after all. Scientists call this inflammaging. It's one reason why older adults face higher risks of chronic diseases. 8th, hormonal changes. As we age, low levels of testosterone and estrogen can increase inflammation. This is why both men and women often experience more inflammatory symptoms as they age and hormone levels decline. And finally, poor dental hygiene. This is an often overlooked driver of chronic systemic inflammation. When harmful bacteria build up in your mouth, it causes gum disease and the inflammation enters your bloodstream. You can check out my video on dental hygiene with Dr. Brad Feifley, a dentist whose mission it is to fix all of our smiles. The key takeaway, chronic inflammation usually doesn't have just one cause. It's typically a combination of factors, which means you need a comprehensive approach to fix it. Now I'm about to tell you something that might shock you. The foods you think are healthy might actually be making your inflammation worse. And the best part, you're probably eating them right now. Let's talk about the foods that are literally fueling the fire of inflammation in your body. If you're serious about reducing inflammation, you need to cut back on these. Number 3 will shock you. It's in almost every American diet. Wait until you hear why it's so inflammatory. So, number 1, sugar and sugar-sweetened beverages. I want you to think about everything you drank today. Coffee with sugar, soda, sweet tea, fruit juice. Here's a problem. Every single one of those is triggering inflammatory chemicals called cytokines in your body, basically telling your immune system to go on high alert. A simple rule of thumb is to never drink your calories. Number 2, refined carbohydrates. Think white bread, white rice, regular pasta, pastries, and most breakfast cereals. These foods lack fiber and cause rapid blood sugar spikes, which trigger inflammatory responses. You can check out my video on the glycemic index to better understand that process. Number 3, processed and red meats. Hot dogs, sausages, deli meats, bacon, and large amounts of beef. These contain high levels of saturated fats and compounds that promote inflammation in your body. My kids love them, but they're not good for them. Number 4, fried foods. French fries, fried chicken, onion rings, and anything deep fried. These are loaded with pro-inflammatory omega-6 fatty acids and chemicals called acrylamides that form during high heat cooking. I get it, I love them too. Number 5, trans fats. These are found in many processed snack foods, frozen pizzas, refrigerated dough products, and margarine. Trans fats are so inflammatory that many countries just have banned them outright. Number 6, excess omega-6 fatty acids. These are found in corn oil, safflower oil, and sunflower oil. While you need some omega-6s, most Americans get way too much, which creates an imbalance with anti-inflammatory omega-3 fatty acids. That's why we track ratios. Number 7, excess alcohol. More than 1 or 2 drinks per day promotes inflammation throughout your body, especially in your liver and gut. My rule of thumb is not to have more than 2 drinks in a day and not to drink 2 days in a row. To get a good handle on the health benefits and the real cost of alcohol, check out my video linked above. Here's the thing, you don't have to eliminate all these foods completely. But if you're eating them daily or multiple times per day, you're constantly feeding inflammation. Think of it like throwing gas on a fire and then wondering why the fire won't go out. There are lots of foods that actually help your body heal. You can check out my video on anti-inflammatory foods or the Mediterranean diet to get a good start on simple changes that will build up your health over time. To get a really good handle on how food is medicine, check out Dr. Edney's YouTube channel linked here. There's one important note. Dietary changes take time. Give your body at least 6 weeks of consistent anti-inflammatory eating before you expect to see results in how you feel or in your blood work. So what's the point? Will reducing inflammation actually help you live longer? This is the big question, right? Is all this effort actually worth it? The science is crystal clear. Yes, reducing inflammation absolutely helps you live longer and better. In fact, reducing chronic inflammation can add 10 to 15 years to your life. That's a decade and a half of extra time with your grandkids, your loved ones, or just enjoying the life you worked so hard to build for yourself. Here are the facts. Chronic inflammatory diseases are the leading cause of disability and death worldwide. Heart disease, cancer, diabetes, Alzheimer's, chronic lung diseases, all of these have inflammation as a core driver. Let me put this in perspective. Studies show that people with elevated CRP levels have significantly increased risk of heart disease. If your hsCRP is above 3, you literally have double the risk. But here's what's exciting. You can cut that risk in half by just reducing the inflammation. That's huge. And people with both chronic inflammation and other risk factors like diabetes or obesity face more than double the heart disease risk death and nearly triple the cancer death risk. But here's the encouraging part. When you reduce inflammation, these risks go down dramatically. The key is this: addressing inflammation early makes the biggest difference. The longer you let chronic inflammation continue unchecked, the more damage it causes. But your body has an amazing ability to heal when you give it the right tools. I've seen patients in their 50s and 60s come into my office exhausted, in pain, convinced they'd be on medications for the rest of their life. Then they made these changes. Within 3 months, their energy returned. Their inflammatory markers dropped by 40, 50, sometimes even 60%. They stopped waking up in pain. They got their lives back. And they kept saying the same thing: I wish I'd done this years ago. It's never too late to start, but the sooner you begin, the more years you get back. Think of inflammation like a slowly leaking pipe in your house. You might not notice it at first, but over time it causes massive damage. The sooner you fix it, the less damage occurs and the better your house holds up over the long run. So the answer is clear. Yes, reducing inflammation helps you live longer, healthier, and happier. But knowing what to do and actually doing it are two different things, which is why the next section is critical. In just 60 seconds, I'm going to show you exactly how to make this happen, starting today. This is the most important part, so stay with me. Imagine your body as a battleground. Everyday choices you make, what you eat, how you move, and how you rest can either calm the fight or make it a lot worse. The truth is, tackling chronic inflammation doesn't require superhuman efforts. With smart, proven strategies, you can restore balance and heal from the inside out. Let's walk through these steps together. And here's the key. You don't have to do all of these at once. In fact, that's where most people fail. They try to change everything overnight and they burn out. Instead, I'm going to show you 10 simple changes you can make, starting with the most powerful one. Step 1, anti-inflammatory diet. Food matters. Choosing an anti-inflammatory diet is one of the most powerful changes you can make. Fill your plate with colorful fruits and veggies, fiber-rich whole grains, healthy fats like olive oil, nuts, beans, and fatty fish. By cutting back on processed foods, added sugars, fried items, and excess alcohol, you're taking away the fuel that keeps inflammation burning. Check out my video on anti-inflammatory diets for more details. Step 2, exercise, and no gym is required. Here's something that might surprise you. You don't need to become an athlete. In fact, the most anti-inflammatory exercise is something you can do today. Just 30 minutes of brisk walking 5 days a week lowers inflammation as much as some medications do. That's it. No gym required. No special equipment, just movement. For extra motivation, check out my book review on Spark. You'll learn how consistent exercise can impact every area of your life. Since I read that book, I walk 2 miles every morning. Step 3, weight management. This also plays a major part, and here's what's exciting. You don't need to lose a ton of weight to see results. Studies show that losing just 5 to 10% of your body weight can reduce inflammatory markers by 20 to 30%. So if you weigh 200 pounds, losing just 10 to 20 pounds can cut inflammation dramatically. That's within reach. Carrying extra fat, especially around your belly, increases inflammation. Shedding even a small amount of weight can really help lower those harmful chemicals in your bloodstream. If you need help, you're welcome to join my practice for medically monitored weight loss. Step 4, stress management. We should never forget stress. Chronic stress is like throwing logs onto the fire. And here's what most people overlook. Chronic stress is creating constant inflammation without you even realizing it. But here's the good news. Stress reduction isn't complicated. It doesn't require hours at a meditation retreat. Activities such as yoga, meditation, breathing exercises, and just being out in nature can reduce stress and help lower inflammation. Make time for what soothes you. You can check out several techniques to deal with stress on my mindfulness playlist linked above. Step 5, sleep for 7 to 9 hours. This is non-negotiable. It's absolutely critical. Here's what happens. While you sleep, your immune system works to repair inflammation damage during the day. But if you're not getting 7 to 9 hours, that repair process falls apart. It's like trying to fix a broken roof while it's still raining. The damage just keeps getting worse. Set a routine and stick to it. If you need help, you can check out my video on sleep hygiene for tips and techniques. Step 6, quit smoking. If you smoke, I'm going to be direct with you. Quitting is non-negotiable if you want to reduce inflammation. Smoking undoes every good thing you do. You could eat perfectly, exercise daily, sleep 8 hours, and smoking would still overwhelm all of that. But here's the encouraging part. Most ex-smokers see inflammation drops within weeks of quitting. Limiting alcohol helps too. If you drink, I encourage my patients to splurge on really high quality alcohol. Top shelf liquor will generally be much less inflammatory and it'll feel more like a treat instead of a regular habit. Hopefully the cost will help limit how much you drink too. Step 7, optimal oral hygiene. Poor dental hygiene doesn't just affect your teeth, it floods your bloodstream with inflammatory bacteria and chemicals that trigger inflammation throughout your entire body. The good news is this is one of the easiest causes of inflammation to fix. Start by brushing your teeth twice daily with a soft bristled toothbrush and, this is critical, floss every single day. Most people skip flossing, but that's where harmful bacteria hide and build up. If you have any signs of gum disease like bleeding gums, swelling, or red tissue, schedule a professional cleaning or see a periodontist. These aren't luxuries, they're part of your inflammation reduction strategy. You can check out my video on oral hygiene with Dr. Fifley here. Step 8, gut health. The next area to focus on is something most doctors completely miss, your microbiome. Your gut contains more bacteria than cells in your entire body, trillions of them. And here's a connection. Your gut bacteria directly control whether your immune system rages with inflammation or stays calm. You literally have a bacterial army inside you right now that can fight inflammation or fuel it. Eating plenty of fiber, enjoying fermented foods like yogurt, and if needed, taking a probiotic can make a huge difference. To get a better handle on these topics, you can check out my videos on understanding your microbiome, fiber maxing, and probiotics here. Step 9, supplements. They can help fill the gaps, especially if your diet doesn't provide enough nutrients or if you have specific deficiencies. But here's what's crucial. Not all supplements are created equal, and some actually make inflammation a lot worse. That's why you need guidance. Omega-3 fish oil, turmeric, ginger, and vitamins such as D, E, and magnesium have all shown anti-inflammatory effects. Just be sure to talk to your doctor before starting any new supplement. You can check the description for high-quality supplements we recommend for our patients. Videos on each topic are linked as well. Step 10, medications. For some people, medications are a crucial part of the plan, especially if inflammation has been building for years or if you have serious underlying conditions. Medications like statins, metformin, and GLP-1s have strong evidence for reducing inflammation and preventing disease. But the key is knowing which medication is right for you, which requires monitoring and adjusting. These should always be used under a healthcare provider's guidance to keep you safe and get the best results. To learn more about each of these, check out the videos linked here. Now here's the amazing thing. All these changes work together synergistically. You don't need to be perfect. Start with just one thing today. Add 1 serving of vegetables. Take 1 30-minute walk. Go to bed 30 minutes earlier. Then next week, add another. This compounding effect is where the real magic happens. Most people who commit to this see results within 3 to 6 months, and some feel better within weeks. So now you know what to do and why it works. But the last critical piece is finding someone who can help you stay accountable and adjust your plan as your body changes. The next step is the most important one. This changes everything. Stay with me for just 90 more seconds. Here's the truth. Chronic inflammation isn't something you have to just live with. This isn't a death sentence. It's a wake-up call. And wake-up calls expire if you ignore them. You now understand what inflammation does to your body, what triggers it, and exactly how to fight it. But here's what I've learned after years of practice. Knowledge alone doesn't change anything. You can know exactly what to do and still not do it. The difference between people who get better and people who don't isn't what they know, it's that they take action and get help. The doctors who get the best results aren't the ones who just hand out supplements and say, call me in 3 months. They're the ones who monitor everything, your energy levels, your sleep quality, your actual inflammatory markers, your mood, how you feel day to day. They adjust your plan when it's not working. They celebrate the wins. They're watching for real improvements in how you live, not just watching lab numbers. That's the difference. When you finally get inflammation under control, the transformation is remarkable. You wake up refreshed instead of exhausted. The brain fog lifts and you think clearly again. Your joints stop aching. You have energy to tackle projects you've been putting off. Or at least if you don't do them, it's not because of inflammation. Your mood improves. Your relationships get better because you're present and engaged again. You rediscover the confidence and vitality that makes you feel like yourself again. The key is finding the right partner for this journey. Someone who gets it. Someone who understands that inflammation isn't a one-size-fits-all. And ideally, someone with experience helping hundreds of patients do exactly this. That's where I come in. You're welcome to join my practice at Bespoke Concierge MD. We're here to help nationwide with a simple promise. We'll help you reduce inflammation, get your energy back, and feel like yourself again. How do we do that? Evidence-based nutrition guidance, real lifestyle coaching, regular lab monitoring so you can see your inflammatory markers dropping, and medical care specifically personalized to you. Whether you're looking to prevent chronic disease, finally get relief from symptoms you've dealt with for years or optimize your health from the inside out, we're here to guide you every step of the way. Don't waste another day. Every single day you wait is another day your inflammation is causing damage. Your heart is working harder. Your brain is getting foggier. Your pain is getting worse. But it doesn't have to be this way. Take action today, right now, not tomorrow, today. Before you click away, I want you to do one thing, and I'm serious about this. Pick one change from this video that you're going to make today. Again, not tomorrow, not next week, today. Make it specific. I'm going to buy salmon for dinner today. I'm going to take a 30-minute walk this afternoon. I'm going to go to bed 30 minutes earlier tonight. Then comment below and tell me which one. Because you know what? The people who comment are the people who actually do it. They've made a public commitment, and that's how real change begins. If this information helped you, please like this video and subscribe. But more importantly, share it. Right now, today, share this with someone you know who's struggling with fatigue, pain, or brain fog. You might literally be changing their life. Their health might depend on them hearing this message. Don't keep it to yourself. Remember, chronic inflammation is treatable, and reclaiming your energy, health, and quality of life isn't just possible, it's waiting for you. Take the first step today, and let's work together to build the healthiest version of you.